very much enjoyed yesterday. I thought we had an excellent session. I was very impressed by the quality of the questions coming from the audience. You guys obviously are, at the beginning, as you remember, I admonished you to start using your brains because we had a lot of stuff coming at you, and you guys were certainly up to the task. Very, very sharp audience. So look forward to another day. Today's a little longer, and we have a lot of heavy stuff to go through. So again, we welcome your questions as always. And again, thanks for being here, and thanks to the organizers. It's a fantastic meeting. Today, let's see, is the projector working? Let's see, I'm just going to talk for a few minutes here. I just want to go over what we did yesterday. We talked about the basics of ocular melanoma, kind of what it looks like in the eye doctor's office. That is the, how do we diagnose the eye? What is ocular melanoma? And then sort of how we work it up and how we treat the variety of treatments we have and staging. Again, it was very brief touching on all these subjects. We also talked about prognosis, how we look at genetic testing. Had some excellent talks by Dr. Ganguly and Derek Matskold. And we looked at the chromosome analysis and the GEP testing. We learned about Kaplan-Meier curves even. So you guys are at the graduate level of education, I would say. We talked about surveillance. And so today, this morning, we're going to have Dr. Carol Shields, who I'll introduce in a moment, who has an interesting, intriguing title, which I'm eager to learn more about. We're going to talk about detecting metastatic melanoma and then treating metastatic melanoma. I just want to introduce a couple of ideas. This came up last night in some of the conversations I had with some of you at dinner. I was asked one question: is there a cure for all cancer, or can someone come up with something? And that sounds kind of pie in the sky type of a question. But the reality is cancers do share a common mechanism, which we call the cell cycle. And this is a fundamental concept in biology. And this is how cells divide. So if there's an engine that drives the division, it's something called the cell cycle. And basically, as you start with one cell, and you end up with two cells. And this is sometimes known as mitosis. But the cell cycle involves something called the S phase, DNA synthesis. So DNA, as we learned from Dr. Ganguly, is in the chromosomes. And all cells simply have to have DNA replication as part of division. So many of the treatments that you have, radiation, chemotherapy, they're designed to interrupt the DNA synthesis. So that's one thing one target of therapy. And as you know, dividing cells are important also for normal functions of the body. Just how in general, just taking back a step back and looking at the big picture, how are cancers treated in general? It's a variety of approaches. Surgery, you can remove cancer. Ablation, you can destroy it with laser or heat. Radiation can be used, various forms. We call it ionizing radiation. It damages a bunch of things, but it does damage the DNA and prevent division. Chemotherapy, again, can destroy DNA either directly or indirectly by interrupting the metabolism that makes DNA. There's immunotherapy, looking at trying to focus the immune system on the cancer, train it to attack the cancer. And then there's another area, newer therapies that we've heard about, we'll hear about more today, where you're targeting things. Don't bother trying to squint to read what those little letters are, but people have heard of things, MEK kinase inhibitors and RAS kinase, and this starts to get very complex when you start to sort it out, read papers, and inform yourself. And the long and short of it is there's very complex pathways, molecular pathways, that trigger cell division. So we looked at this, how would this work? Whatever signal is propagated through a very complex machinery, if you will, and at the bottom here would be that cell cycle. Boom, division. So some targets are at various points in this pathway, and that's some of the newer drugs. They're looking at targeting this sort of triggering mechanism. Why is it so difficult to cure cancer? I mean, we've only been working on this, 30, 40 years as a nation? Well, cancer cells, they invade the normal tissues, and it's hard to attack them without damaging normal tissue, as many of you know. And so I wanted to point out in my own mind a way I think about it sometimes is that cancer cells are very similar to healthy cells in a way. They're foreign in a way. We want to get rid of them. And I think of an analogy, medical treatments for bacteria, for example. Bacteria are pretty easy to kill, given an antibiotic. Bacteria are quite different than our normal cells. Fungi are actually more similar to human cells, and they're a little harder to kill. It takes more time therapeutically. But cancer cells are very similar to normal tissues in many regards, and that's why it takes longer. You have to have multiple modalities to treat these cells. So we're looking for the chink in the armor. Some of us discussed that yesterday about the genetic patterns. Perhaps we can interpret this genetic information and find out, hey, here's the vulnerability. But they are starting with the same set of information, the same chromosomes as we all have. There's all of our normal healthy cells. So it's really quite a challenge to find that, what I would call a balanced approach, where you can selectively kill the cancer but preserve the healthy tissue. And that's basically it. I just want to introduce some just basic concepts that we haven't talked about yet. So, well, with that, I'd like to move on and introduce our first speaker of the morning.